So yes, HIV can last up to 10 years without showing symptoms. Now this, however, does not mean that it also takes 10 years for it to be detected. Unfortunately, by the time these 10 years happen, the body has given up fighting. So it fights until the virus supersedes your immunity to be able to fight further. Yeah. The last video that I created about HIV, there were so many questions about this, and it was my best performing video, so I decided to do a refresher video about it and answer some of the common questions. Yeah. People ask questions about the window period. When is the window period for HIV? People were saying, if it takes 10 years, then how will I know that I'm HIV positive? Some people were asking. So I'm even going to go through some of the comments that we can be able to read through and we see. Yeah. Number one, HIV will take 10 years to show symptoms, but it can be detected much earlier following exposure of the virus. Now, window period is a time taken by a particular test to show whether you're HIV positive or negative. So it's the time that a particular tests take to detect the virus. Now, for example, different tests have different window periods. Number one, we have antibody tests. All these are the rapid tests. These are the most common tests. These particular tests can take up to 3 months to show you that you are actually having the virus in your body. These ones, they can do a finger prick or a venous prick, which is a venous sample is always a better one to be able to give us the results. Then there's other tests called like the ELISA. These ones are the antibody or antigen tests. These ones take up to 1.5 months. So within 45 days, they're able to give you a period of time. It can be less. They normally have a range of time that they go in, but within 1.5 months, you're able to be detected. The other test, which is normally the very good test, is the nucleic acid or the DNA PCR test. Also, I think some of you remember the PCR tests that were done for COVID. Now, there's the DNA PCR test that can be done for HIV. This one is a bit more on the pricier side, but it can be able to show us, detect for us the virus within a period of 2 weeks. So it gives you a bit from 10 to 30 days it can detect. So we take its average to be at 2 weeks. It's a very good test and it helps us to detect. So this DNA PCR test is also done for children or babies who have just been exposed up to about 6 weeks, who have been exposed, like let me say during birth, you suspect that the child may have contracted it from the mother. This is the test that we do. This takes me to the drugs. Now, there was questions about PEP and PrEP. When do we take this? What do they mean? So, for example, the most common one that people know about is PEP. This is the post-exposure prophylaxis. It's antiviral therapy, but it's used for a period of 30 days or a period of a month. There used to be previous PEP drugs that would cause things like the hallucinations, nightmares, but those were then switched up, and now the ones which are there are a bit more comfortable and tolerable. PEP is taken for a period of 30 days from for following exposure, and it works within 72 hours. So if you've been exposed, those first 3 days are very critical for anybody who has been exposed. The people who have had, especially people who have had sexual assault, or if you had sex with a person that was unprotected and a person whose status you didn't really know, these particular drugs are very helpful in that period of time. The other drug is called PrEP. This is pre-exposure prophylaxis. Pre-exposure prophylaxis or PrEP is the one that is used before, or a person who, before you actually get exposed. So PEP is after you've gotten exposed, so it's called post-exposure prophylaxis. PrEP is pre-exposure prophylaxis for before you've gotten exposed. Now for PrEP, it's a drug that is taken daily as if you're taking HIV drugs. This one is for people who are at high risk of getting HIV disease. Yeah. So for example, people who are like sex workers, or if you have a partner that is HIV positive, this drug you take daily as well to prevent you from getting exposed to the virus. Now, another thing you need to know is about for babies who have been exposed or there's a possibility of exposure, there's a certain syrup that we tend to use commonly is nevirapine for babies who have been exposed. They will give them this medication following birth, and then they continue with it until they have been proven negative, especially commonly at 6 weeks of exposure. One thing that is very beautiful, and I'm like, you know what, God is such a marvel, is that when a mother is during pregnancy, a mother's blood and baby's blood do not mix in general. So that means that there's the risk of you getting HIV during the pregnancy itself are very slim. The problem is in case any trauma happens during the delivery, or during delivery, or in case any trauma happens. So like mothers who have been traumatized, accidents, she has been hit, assaulted, and you end up causing a breach. So there's a connection between the mother's blood and the baby's blood. Otherwise, if that does not happen, most times you find babies are born and they remain HIV negative. Even when you have recurrent tests, they are just right about good. So this is a good question. Then I'm going to go through some of the comments and then answer a few of the other questions. There were some questions about signs and symptoms. I will attach them because I discussed them in the first video. Then we start from there.